Daniella Lock is a patient education specialist at SeamlessMD, where she designs evidence-based digital care plans for patients. Daniella has a Bachelor of Health Sciences from the University of Ottawa, a Master's of Science in Health Education and Promotion from Maastricht University, and received her Adult Education Certificate from Seneca College. As a patient education and health promotion specialist, Daniella is passionate about improving patient care by applying behavior change, adult learning principles, and plain language skills when building digital programs. Outside of work, Daniella likes to cook, travel, and try many different foods. She's also an avid soccer player and loves going on long walks with her dog. Daniella, welcome to the show.
Yeah, thank you for having me. I'm excited to be here today.
Welcome, Danny.
Thanks, Josh.
So yeah, can we call you Danny? Is that the preferred name, Daniella?
Yeah, that's fine, Danny. I know there's a lot of Dans, Daniels, Daniellas at the office. So yeah, call me Danny.
It is the most common type of name in the organization. That's very true.
Yeah.
It's so common that I'm not even sure what number 2 is in the company.
Yeah.
Yeah, I think there's anyone.
Well, it's also funny because there's multiple Daniellas as well. So there's Dans, Daniels, Daniellas, Danny's. No, that's great. So Daniella, we are super excited to have you on the show today. You've recently launched our spine surgery program. And so there's a lot to unpack with, how spine surgery works on digital patient engagement. Maybe before we jump into exactly what you've done with the spine surgery program, just for folks listening to the program, we want to explain what digital patient engagement actually is and how it works. So I'm actually going to pass it over to Josh to give a brief explanation on what digital patient engagement is and how it works for patients and providers.
Yeah, for sure, Alan. So, imagine, I guess, typically when a patient travels through a healthcare journey, whether it's a surgery, a cancer journey, or a chronic condition, usually they get lots of, paper and verbal instructions to guide them, which they lose, they forget, it's not really personalized. And then also there's no easy way for a healthcare team to keep an eye on a patient as they go through that journey. And there's no easy way to monitor a patient and catch any problems earlier. So the basic idea behind patient engagement platforms like SeamlessMD is we engage patients on their smartphone, their tablet, or their desktop computer, and we guide them throughout that journey in just a much more interactive way. So patients get reminders of what to do at the right time. They get interactive education such as, exercise and physiotherapy videos. But probably one of the very exciting things that we do is empower the patients to track progress and data. So patients are often tracking symptoms, pain scores, and decisions of their photo. And then that data can be captured by the healthcare team through alerts and dashboards to monitor them and catch things much earlier. But I would say one of the things that we've learned is that a lot of the right education and expectations and progress that should be tracked really varies from depending on surgery type or health condition. And so, Danny, we're excited to kind of learn from you more about what are some of the unique elements in a spine surgery program on a platform like SeamlessMD, and then some of the results that you've seen so far. So maybe Alan, I'll pass it back to you to kind of ask around the spine program.
Yeah, that's great. Thanks, Josh. So actually, Danny, maybe before jumping into the specifics of the digital patient engagement program that you've built, I'm curious just to know, what are some of the concerns that spine patients in general have? What do they care about most before going into their surgery or as the surgery is unfolding and into recovery?
Right. Well, spine patients really, when we talk to them, they really want to know about how they'll be able to cope after surgery. Patients who are getting spine surgery have probably already gone through a pretty complex process in making the decision on whether or not to undergo the surgery. So they're usually getting surgery because they have severe pain, they have poor physical function, so they're not able to do a lot of activities of daily living without help, or it can be really debilitating and can actually interfere with their active lives and their overall happiness. So I think what patients have expressed or brought up the most is whether they're going to be able to do things afterwards. So is their pain going to get better? Is their numbness or weakness going to get better? And I think for the most part, the goal of spine surgery is actually to kind of reduce severe symptoms. And there's always a chance that patients may have some pain or numbness after surgery, but hopefully it would improve. So I think with our program, it really helps spine patients with normalizing what it's going to be like after surgery. educating them about pain they may still have, the limitations of movements they're going to have to follow, following their precautions. And I think these are the components of our spine program that really help patients feel less anxious about whether it's before or after surgery, and it covers what they care most about.
Got it. Yeah. So a lot of expectation management and really, guiding the patient along through those concerns. What about in terms of the actual procedures that our spine surgery digital care plan covers? I know there's obviously a ton of different spine procedures, and it sounds like we're talking more about elective cases. What are the different spine procedures that you've built into the program?
So our program pretty much has two pathways. So we have the cervical spine pathway, which is anything related in the neck area. And then we have our lumbar spine, which is mainly in the lower back. So we break down our surgeries into either decompression surgeries, which are procedures that remove any structures that are compressing on the nerves. So for example, we have our procedures like discectomies, laminectomies, laminoplasties, and corpectomies. And then we also have our group of procedures that are fusions. So surgeries or procedures that join two or more vertebrae together. And these can differ depending on kind of the surgical incision site. So anterior fusions, lateral or posterior as well. For the most part, decompressions tend to be a little bit easier surgeries to do, meaning that they're less complex than fusions. Fusions may have longer length stays, more restrictions, and longer recoveries as well. But the thing is that sometimes these procedures are done at the same time. So sometimes patients may get a decompression and a fusion together. Sometimes they may get like a discectomy and a fusion, a laminectomy and a fusion. So patients may have more than one procedure done during the surgery, and this is quite common as well.
I see. And does that impact the actual recovery and the things that patients have to do to either prepare or recover afterwards?
I think for recovery, if anyone is going to go through a fusion, there may be a longer recovery with a few more limitations compared to if they're only getting a decompression. And also length of stay may also be a little bit longer as well.
Most people are probably familiar with, this general idea of patient engagement by now. They're listening to our stuff, but I was curious for your spine program specifically, are there any unique educational elements or progress tracking elements that may be more unique to spine versus some of our other care plans?
Yeah, so for spine, there are actually quite a few unique features that aren't included in any of the other surgical pathways that I've worked on. So for example, some education on specific precautions. So for spine surgery, it's usually recommended to not do any BLT, not the sandwich, but no bending, lifting, or twisting, and also with some weight restrictions as well. Another feature that we have that's actually highly appreciated by our patients is our education section about how to move around safely at home after surgery. So things like getting in and out of bed, how to sleep, how to pick things up safely if they do need to do it, because this is part of their daily routine, how to get in and out of the car. These are things that patients find very valuable. And these pages in our program are filled with illustrations that show step-by-step instructions on how to do these movements safely. And from feedback, we know that these are things that patients want to know and they want to anticipate, and that they anticipate when we build these programs. So it's nice that we have these in our program so patients are able to actually do these movements and learn how to do them safely.
Right. And Danny, I was curious, like when I know one of the things that we can do on Seamless is we can kind of send out education and prompts at certain times in the patient journey, when it's most relevant. So for things like, let's say, precautions, like spine precautions, like when is that content going to the patient? Are we typically sending that out like when they're still in hospital about to be discharged? Is that something that comes out more when they go home? Like, how do you time that?
So usually they are getting the precautions when they're in the hospital. So we've worked with the clinical teams or the hospital teams to kind of get those same precautions that they prescribe to the patients and put them into our program so that we can send out reminders to follow them after their discharge as well. So we're able to send out reminders in hospital if the clinical teams decide to do that as well, but most importantly, out once they're discharged, because they aren't with any of their healthcare teams once they're at home. So it's just nice to remind them and to actually give them some education and show them how to do it, just from like a laptop, a phone, a tablet, or anything like that.
And I know like people, I mean, if they haven't seen the platform, they don't know this, but one of the things I really liked about the way the program is designed is that if there is a precaution, you have this like really big like red X over the movements that the patient should not do. Because I can see how there are certain patients where if you didn't have that big red X, they would just see a certain movement inside the program or in their booklets, and the patient might think, oh, I have to do that.
Exactly. Yeah. So we really try to make it as simple as possible for the patient to understand all of our instructions. And like you said, just having a big red X is kind of a universal symbol for them not to do it.
Right.
So
that makes sense. So actually, Danny, from the other kind of total joint digital care plans that I've seen in our orthopedics work, there are these unique trackers built into the system or unique survey questions, such as like range of motion for a knee replacement, as an example. Is there anything that's unique to spine that's been built into like more of a survey or one of these trackers?
Yeah, so in our survey, we have some questions that ask about any neurological changes. So these are specific to spine surgeries. So we ask if they've had, let's say, for example, for a lumbar patient, we ask if they've had any nerve pain in their lower back, their buttocks, their legs, or their feet. And these are specific symptoms of nerve pain for these patients. If they do select yes, then we actually follow up with questions to make sure that we're giving them the right recommendations for the right for the problems that they're having. So we usually ask, like, is this pain new or increasing? Is it new after surgery? If they select yes, then we know that these are symptoms that are a little bit more concerning that we would like them to follow up with the healthcare team. If they select no, then we kind of direct them to some self-care tips where they're able to kind of manage it on their own, whether it's walking, kind of resting, or anything like that. So we do have some follow-up questions to really kind of flush out the right recommendations to the right problems.
Yeah, that's great. Sorry,
Sorry.
go ahead.
Yeah, no, and then some other questions that we have about like neurological changes for our spine program are changes or symptoms about cerebral spinal fluid leakage. Sorry, that was helpful. But we ask them about that. So if they have a positional headache, if they feel nauseous when they're upright, but better when they're laying down. So we know that those symptoms are specific for spine patients that need to be addressed by their healthcare teams. And also some symptoms about bowel incontinence, urinary retention, and those are actually specific to lumbar patients as well. So we ask if they have any of these problems. And again, if they do select that they do have these problems, again, it is a little bit more concerning that they do need to reach out to their healthcare team to have them help them manage it.
Right. I think it's neat. Like it's a really small example of a larger system that's at play when it comes to like branching logic. For instance, you're asking the patient, is the pain or do you have pain here? And then if they select yes, it then follows up with another question asking if it's increasing or if it's new and sudden. And that's obviously built in and designed throughout the entire system to have kind of those branching questions. My question actually is around, and I don't know if you know the answer, but I'm curious, how did spine programs collect this kind of information in the past? So if they didn't have this digital tool where patients are able to, input how they're recovering, is that something where they would have to be manually tracking or calling the hospital about, or do you have any idea on that?
Yeah, I feel like patients would have to call the hospitals for any problems that they thought they might have. So with the program, it's really great because we can really kind of get those specific symptoms that we know are a little bit more problematic to have them call the surgery team. And for those that are actually able to be managed on their own, patients are actually getting, with our program, getting some tips on how to do it at home so that they're not always calling the healthcare provider. And I think this really also kind of gives patients more confidence in their own recovery and increases their level of self-efficacy as well for kind of taking charge of their own health after surgery. So
right.
And I know so for those who don't know, whenever Danny's team creates a new template digital care plan on the platform, Danny or one of the other team members would actually do a little presentation, I guess, to the whole company on like, what is this new spine digital care plan and why are we doing it? What are some of the problems that we're looking to tackle, and what are the unique elements in a spine program versus another digital care plan? And I'm just like looking back at some of the slides that you had, Danny. So it sounds like for improvement opportunities for us for spine programs when it comes to quality, you kind of highlighted readmissions were a big thing. So, I mean, I think you shared some data from a study where in that group, about 9.4% of spine surgery patients were readmitted, and kind of the top issues were infections, pain management, blood clots. And then sounds like from looking at some of the sort of symptoms and issues that you're having patients track on Seamless, we are addressing a lot of those, right? Like we're tracking risks of infection, pain scores, et cetera, et cetera. So, and I'm guessing like the programs you're working with so far, like they are also like tracking like wound photos for early signs of infection of the incision, all that kind of stuff.
Yeah, we're tracking like mental health questions, whether it's if they feel depressed, if they are anxious. We're tracking their pain level scores as well, specifically surgery wound pain. We're also tracking like infections. Patients are able to take pictures of their wound and actually send them in to their clinical team if there is something that they think is problematic or it needs some attention at least. So yeah, we still are tracking all of that with the questions. And something else that's actually really important for spine programs is our walking tracker that we have in our health check. Walking is probably the most important exercise that spine patients can do, even though we do have a library filled with other exercises that may be prescribed, whether it's cervical or lumbar patients, that our clinical teams can actually just pick and choose which ones they want to put into the program. I think the walking tracker and our health check is actually one of the more used features that we have because it is so important. So with our walking tracker and our health check, patients are actually able to kind of track the progress that they're having with the amount of minutes that they walk every day. And they're actually able to see the progress that they have throughout the recovery. And this is something that the healthcare team not only loves, but also patients as well. They can see how well they're recovering when they're using our program.
That's great.
Awesome.
So,
oh, sorry, Kat, you go first.
No, that's okay, Josh. Go for it.
Okay. Well, because you insist. I remember you also mentioned that there's more enhanced recovery after surgery or ERAS principles being used in spine surgery, I guess, depending on the organization. Do you recall like if you and your team added in kind of any ERAS elements into kind of the template?
That's kind of what I've been working on now with the components that we have. None of the teams have actually had an ERAS nurse or anything kind of see if it aligns with our ERAS protocols, but that's actually something that I'm looking at now and improving our template. So yeah, I was just looking at that yesterday. So yeah, cool. Something that will be coming up.
Awesome.
That's awesome. And like tracking compliance to those protocols is kind of the big gap. I think a lot of ERAS programs are kind of reporting like, that's the really kind of challenging part of ERAS is how are we going to track compliance to make improvements and things like that. So Danny, actually, you mentioned how these types of programs really are kind of boosting patients' self-efficacy and building their confidence and hopefully, helping with their anxiety and things like that. What has been the feedback from spine patients that you've heard? What do they like most about the program? What have you heard on or from the healthcare teams from patients?
Yeah, well, I feel like patients have really expressed that this program has made them feel more confident about taking care of themselves after surgery. All the education, the health check as well, that goes over all of their symptoms, any pain that they may have, any weakness or numbness, and it reviews all of these with them and provides them with recommendations on what to do exactly. So patients feel like they're able to actually control their own recovery. They feel less worried using this online program because they have the information there at the palm of their hands, really. It's like having a nurse with them. So they're able to monitor their improvements as well. Like we said, in the health check, we have They can monitor like if they're walking more, if they're having less pain, less surgery wound pain as they recover. And they kind of feel, I think, a sense of security with the program as well. They feel more empowered to be active in managing their own health.
And Danny, I think I also read that at least certain partners are collecting various patient-reported outcome, like validated surveys. Like I think like the ODI you might have mentioned, for example. Are there a couple in particular that you've seen more common lately with the partners we're working with?
Yeah, so definitely the ODI for our lumbar patients, and then we've also been collecting the FQ12 as well. So I think that's kind of just to do with the patient's everyday health and collecting some of those numbers as well.
And I think that's also, you know, beneficial that it's kind of wrapped all into this digital care plan for them, because in the past, you know, maybe they are collecting patient-reported outcomes and validated surveys like that, but it's almost disjointed from their care. It's more of like a, here's a survey that we need you to fill out, as opposed to here's a guide that's going to educate you. And oh, by the way, if you fill out this survey, you're going to get recommendations and more self-management tips. And
the biggest thing I've heard lately actually is hospitals are saying, well, we're still having the patient come in person a lot of the time for pre-op still, and they're coming in and they're completing the pre-op, let's say ODI or some other survey. But in the past, post-discharge, we'd have the patient come back every 3-6 months and complete the post-discharge PRO survey in person. But during the pandemic, like, we're not doing that anymore. And so for a lot of organizations, they get all this pre-op data still. They're getting zero post-discharge data. And so they have an incomplete understanding of, what, did the patient's pain actually get better after the surgery? We stopped knowing. And so I know a lot of partners are saying that a big benefit with Seamless has been, okay, now we're getting both the pre and the post-discharge PRO surveys. So that's been really important, apparently, like almost even more important because of the pandemic.
Right.
Yeah, and it's nice too that we can send them out even after our program is finished, which is usually 30 days post-discharge. We can send out reminders to fill in these surveys at 6 months after surgery, at 12 months after surgery, at 24 months after surgeries, and patients are still able to go in and fill them out. So I think it's really useful for providers to actually have surveys that they want patients to have filled in, and it can easily be filled in at their home.
Right.
Yeah. And one of our customers as well, Multicare, they've been using Seamless to collect some data to do a pre-assessment of the patient as well. So they're collecting data to see if a patient will be able to manage their own health at home. So they ask questions like, are there a lot of stairs at the home that you're going to? Will you have someone who will help you? Are you living in a condo, in a house? And with these pre-assessment surveys, they can actually kind of pinpoint patients who actually need more help. So they're able to intervene actually even before the surgery to see if they can help the patient in their recovery once they're done the surgery as well. So that's kind of one other way that we're using any of our surveys in our programs to send out to patients, and where the healthcare team can intervene and actually make some improvements for the patients.
Yeah, it's pretty awesome. Like I think like in the past, everyone in healthcare was just focused on, okay, like let's try to optimize what goes on in the operating room. And then it became, okay, oh, actually what we do while you're in a hospital outside the operating room has a difference on your outcome and your recovery. Okay, so then we started caring about that. And then now it's extended to, it's like, oh, actually, what we do even before you come to the hospital, or even like how we can help you when you're out of the hospital, has an impact on your outcome and your recovery. So now we have to, as Alan mentioned earlier, like wrap around the entire kind of end-to-end patient journey. And that reminds me, like, we're even now having conversations with organizations about, okay, well, how do we engage patients? I think to Danny's point, I think much earlier in the call, like even way before they even know if they should be even having spine surgery, and how do we actually guide the patient through conservative management? Because maybe if we can help manage their back pain without surgery, that might be better for the patient. And then only if they need surgery do they get the surgery version of Seamless. So it's almost like the role of the healthcare team is going way beyond the hospital. And we're kind of seeing like Seamless play like a bigger and bigger role in that whole journey, which is pretty exciting.
Yeah.
Yeah, I agree.
It's really streamlining an entire experience for the patient, not even just like a surgery patient, but the patient holistically, and taking a look at what's best for their health. Danny, so actually that brings me kind of back to the hospital providers. What's the feedback been like from our providers? What have they said about the digital experience? Obviously, this is pretty new. I don't know of really any other programs that are doing spine digital care plans. So what have they said so far?
I think from the clinical team, they really love that they're able to kind of tailor the program to their own work. Like, for example, we are talking about some follow-up questions from the nerve pains. If the patient has nerve pain, if they select yes, then we follow up, is it new or increasing? These are very specific wordings that the clinical teams usually like to handle and to give very specific instructions. So this is actually, that was something that has been improved with the multiple programs that we've been kind of implementing it with. And the clinicians really like the fact that they can actually tailor all the wording in their program. It's already kind of built for them, but they just can tailor it and make it exactly what they want it to say. Also, like we mentioned before, they're able to add a lot of components that they're probably doing manually or not even getting responses to for patients. So like, for example, we talked about the ODI surveys, the SFQ12 as well, being sent out 6 months after, 12 months after, and 24 months after. Patients weren't really answering these or completing these questionnaires. So I think with Seamless, it's a really great way that they can use this and leverage the resources that they need with our program as well. And this really reduces the time that they may be spending doing these things, having it already integrated into our program.
That's great. Yeah. So, I mean, I have another question, Josh. I don't know if you had any other questions about spine surgery digital care plan in general.
I didn't, but maybe after your question, I might have a few more.
Okay, well, my question is actually shifting gears a little bit, Danny, but we've started a new thing where we're asking all internal guests on the podcast, what do you love most about working at SeamlessMD? And I'll premise this, Danny, you've been at SeamlessMD for a little while now, but still fairly fresh. So I would love to hear what you love most about SeamlessMD so far on this journey.
I think my favorite day to this day is being on the podcast, Alan.
Wow.
Well, that's an automatic re-invite, Alan.
Yeah, exactly.
But apart from that, obviously, like, I love being able to build these programs that will help people improve their care. Working in health tech is really innovative and new, and I really didn't think that I would ever be at a tech company, but I absolutely love it. I love being able to work with the hospitals, the clinicians, the doctors, nurses, physical therapists, just like a variety of people, and being able to collaborate with such a diverse team, as well as our internal team as well. And I really enjoy how challenging sometimes the programs can be, learning something new every implementation that I'm working on. And then also being able to read patients' comments and feedback after the program's been built and how it's helped them. It's actually very rewarding. And seeing the feedback, especially too on how we can actually improve our programs and seeing how patients' ideas are actually flowing. I think this actually really helps us build more patient-centered programs. So I really appreciate that they actually go out of their way and actually give us some information about how we can make it better, because it's really a very collaborative project with us, with the healthcare teams, with patients. And yes, I really, really enjoy working at Seamless.
That's really cool.
Actually, Dan, I think one of the things you mentioned is one of my favorite things too. I mean, the idea that we do get feedback directly from patients, both the good and bad about their experience in the platform. And it reminds me how in healthcare in general, healthcare teams get very little feedback from patients. I mean, like maybe like some patients go on things like RateMDs, or like maybe some hospitals collect patient satisfaction surveys with pretty low response rates, and often they just get scores. They don't really get actual qualitative feedback about what's going well, what's not going well. So it is really actually it should be a normal thing, but it's not in healthcare to get actual feedback from patients. So it's actually, you're right, it is pretty neat that we get that.
Yeah, I love reading the comments whenever I build a program, and seeing what they love about it, especially like, obviously I'd like them to like my program, but obviously also how to improve it as well. Sometimes it's things that we haven't even thought about, but can be such an easy thing to add in that will probably make someone's day better, their recovery better. So yeah.
Yeah. Also, the benefit of it being technology is the scale of it. So you're able to reach, you know, a critical mass of patients pretty quickly, which is, I think, kind of compounds the amount of feedback that you're getting, and that's really great. Josh, did you think of another question or?
No.
Okay.
You didn't give me enough to work with there.
No worries. Okay, so Danny, we're actually going to shift gears now. We do something called, I guess in the past it's been called Fast Five or Lightning Round. It's essentially 5 questions that we ask our guests to get to know them a little bit better. And you can answer the questions as quickly as you'd like, or if you want to spend more time on something, that's fine as well. I'll jump right into it. So the first question we have is, what is your favorite book or book you've gifted the most?
I don't think I've ever gifted a book, but one of the most recent books that I've read that I really enjoyed was White Chrysanthemum. It's kind of a sad story, but it's beautifully written. It's about 2, I guess, sisters in Korea that were separated under the Japanese occupation, but it's just a book that you can just, not that you want to imagine yourself in it, but it's just so visually appealing, and so.
Really cool. Yeah, I'm gonna look that one up. Question 2, how has an apparent failure set you up for greater success?
Well, I guess it's not really a failure, but it was a time in my life where I wasn't really sure what I wanted to do. So after finishing my undergrad, my goal was always to become a physiotherapist, but by the end of my undergrad, I actually didn't really feel passionate about it. So I was seeing a lot of my classmates either going to med school, going to physical therapy, or master's programs, occupational therapy, into research. And it was a time for me to kind of step back and really think about what I wanted to do. That wasn't the way that I wanted to go. So it kind of took me 2 years to find a master's program that I actually wanted to continue with. And I found the master's program for health education and promotion, which really opened the door, really opened my eyes to so many different types of jobs in healthcare, just like this one, that patient education specialist, where I worked, I guess, here and at Sunnybrook. I don't think I would have ever been able to find that without kind of taking a step back, assessing what I wanted to do, and then finding something that I actually enjoyed. So.
Wait, Danny, you totally missed the part where you went to the Netherlands for your master's. Like, how did that happen?
Well, I chose the program, the health education and promotion program, because of the program, but also because of the location as well. I lived in the Netherlands, and it was absolutely wonderful. Like, I would recommend it to anyone. Lots of cheese, lots of biking, beautiful, but very kind people. So it was great. It was a great experience.
That's awesome. Would you move back?
Possibly.
Yeah.
I don't know. Maybe if Seamless opens up in Europe.
We'll add that to the roadmap. All right, question 3. Would you rather have super strength, super speed, or the ability to read people's minds?
Super strength, super speed. I think I would want the ability to read people's minds if I can turn it off and on. I wouldn't I think there's a movie about that where some guy can read people's minds, and like his mind is just always bunched up with a lot of different ideas. But if I can turn it off and on, I would want to do that.
Yeah, that would be a pretty great superpower to have.
Yeah.
Now, what if you couldn't turn it off?
Maybe super speed.
Okay. Wait, Alan, what's sort of like the radius on like if you were like a meter away, would you still hear their thoughts, or could you stay a meter away from people? And
that's actually an interesting point. What if it's you have to physically be touching the person to then read their mind? So it's like you can't do it through the So you have to figure it out, like how to, like, hey, maybe let's go for a handshake, and then you read their mind. Or,
wait, Alan. So that's totally useless in the COVID world. So
and over Zoom or over it just won't work at all.
I was thinking of using the ability to read minds and like being a poker champion.
Oh yeah.
Read that.
That would be really great.
That works. That works.
Yeah, to be honest, Josh can do that already though. Josh is really good at poker.
Oh, I think the reading minds part.
Yeah, Josh just looks for tells and he's quite good at it.
I'm getting a lot of them on the podcast, Alan. I'm collecting, taking notes.
That's good. So question 4, Danny, this one is actually from Jess, who's been on the podcast before, and she told me to ask this. So I don't have a clue what the answer is going to be, but what is a peculiar side gig that you've had or have?
Okay, well, it's not really a side gig, but kind of is. I've been doing it since I was little. I do taste testing.
Taste testing.
Food.
Different
like professionally or?
Like not professionally, but there's this like
a focus group.
Yeah, focus organization that's really close to my house. And I just get called all the time. So I get called to taste test, let's say yogurts, chips. Recently I did like McDonald's burgers. So I think I did their Angus burgers with bacon and some smoked sauce that just came out, I think like last year. So I was one of the first people to try that.
Wow. Okay, now I have a lot of follow-up questions. Yeah. I'll try to keep it short. Have you ever rejected one of those opportunities based on the description?
No, I say yes to everything.
Right.
Okay. The weirdest one was actually...
That was my question. What's the weirdest food?
Yeah, the weirdest food that I tried was toast, but they made me squish the toast and feel a bag of it to see if it was firm or if it was squishy, and then also tried it untoasted and toasted and with butter.
Oh, interesting.
Yeah.
I mean, bread is like...
Yeah, bread.
Yeah, I mean...
But like, I've never heard of somebody squishing a bag of bread or toast. Like, is that part of the experience?
That was the first time I've ever had to touch food before. Right. Usually it's just taste testing. Yeah. But yeah, that one's weird. That was one of the more recent ones too. It just they give you a loaf and you just have to like squish it for a minute.
That's so weird. So I have a question about that.
Wait, Alan, you just marginalized all the listeners who were like, squish their toast. And...
Right. Yeah. I'm gonna hear about that. There's gonna be so many emails of people like, how dare you? I always squish my toast. So I have a question about when you did the taste testing for a McDonald's hamburger, like, did you know it was McDonald's? Did they have the branding and the packaging and everything?
Yeah, so for that specific one, there was branding on it, like it came in the box. And it also came with a description that you had to read, and you kind of have to say, like, does this match the product that you have right? So that was a really good one, because I remember I went hungry and I was like, this is sweet.
Yeah. Like, do they schedule it for around lunchtime?
You can choose. So I usually choose in the evening, but yeah, it's interesting what they change for each of the products. So let's say in the first product, it's like a thicker burger, same cheese, but no sesame on the buns. And then the next, kind of the same, but just has sesame. So it's like little things that you don't even notice, but yeah, that's how they get perfect product.
Now, if you were to go to a store or get McDonald's or something like that, do you just like have an instant flashback to like, oh, I was one of the first to test this?
Yeah, I have that with a lot of products actually. Whenever the pizza Pringles came out, I remember I tested them, and I feel like I've been signed up for this since I was like a real young kid, like since I was like 6 or 7, I've been going. So it's kind of cool seeing all the products coming out in the market.
Yeah.
Are you like, is it an actual group? Like, are you one of many like together doing, or are you like on your own? You have to go like one by one?
So it really depends. They're all different. So usually you just sign up for this organization and they'll call you randomly based on like your demographics. But sometimes it's a group one. Like I remember I did a beer for Black Stella, and it was a group one, and you kind of just sipped it and sat around and talked, and they kind of like asked about the atmosphere and stuff. But the most of the times it's just you and the food product. So you and a burger, or you and like 8 different yogurts, and you have to like eat all of the yogurts.
That sounds amazing.
Yeah.
Honestly, I love it. So that's why I probably just wanted me to talk about this.
How is there not like a huge wait list to get on the list? There must be.
Danny's answers must be really good.
Like, I don't know. I also I think I made friends with a lady that
Oh, there you
works
go.
there.
Yep.
I'm also very close to the place. So I'm about like 2 kilometers. So whenever there's someone that doesn't show up, she calls me and she says that we have this available, and then I'll just go over. So yeah.
Cool. Yeah, I remember I did one of those once. I mean, I've done a few, but one time when I was younger, and it was the like purple ketchup and the green ketchup when they came out with that stuff.
I think that was a bad call. Like,
Yeah.
It was a bad call, but it looks kind of funky.
Yeah.
Yeah, that's neat. All right, last question that we have for the lightning round. This one is a pandemic related question. What is one hobby or activity you've gotten into since the beginning of the pandemic?
I really got into plants, not only indoor plants, but outdoor plants. So I garden a lot now, and I like to cook things that are straight from the garden. So that's
Nice,
something
yeah.
it's just so rewarding eating. Like right now I'm growing like squashes. So I'm just really excited for the fall time to come to have like butternut squash and spaghetti squash. So
but you're growing like butternut squash.
yeah.
Oh, that's cool.
Butternut squash, spaghetti squash, and those are like kind of the ones that I like more because they take a longer time.
Right.
Yeah.
Interesting. So how many squashes do you have currently?
I think right now there's about 4 spaghetti squash and 3 butternut squashes.
Okay.
So yeah.
Did
More
any
than
of
I
the
have.
did
Yeah.
any of the plants not turn out?
I was trying to grow Chinese eggplants, I think, and I
Okay.
think the squash just took over
Oh wow.
and just didn't let it grow. So that's
Right.
the one that I was really disappointed about. But it's okay. Like I love squash, so
Yeah. That's awesome. That is really cool. I like the idea of, being self-sustaining. So like you can totally just live off your own kind of food that you grow and make. No, that's really
Well,
cool.
Danny doesn't have to. They'll just call her in for the next.
That's true too. Yeah. Never go hungry. That's really good. Awesome. Well, Danny, that's the end of the lightning round. I don't have any other questions, for the lightning round of the Fast Five or the spine surgery, but I do want to thank you so much for coming on the show today and explaining, all of the different work that's gone behind the scenes into the spine surgery care plans that you've built on SeamlessMD. Definitely, I hope, this benefits some of the listeners that we have on the podcast. I think definitely clinicians who are involved in spine surgery can take away a lot from this episode. Just understanding, all the little bits of focus that you've put into the program to make it successful for patients. I say little bits of focus, but there's a lot of focus that you put into it, and there's a lot of emphasis on small things, which makes it overall successful as a system. So thanks so much for coming on the show today.
Thanks, Danny.
Thank you so much.